good. I'll give people a few minutes. This should be a quick meeting. We don't have a lot. Hello, Erica. Nice to see you.
How are you?
Good.
Good. Sorry I missed last month. I was traveling.
Oh, no worries. Hopefully somewhere fun and relaxing.
It was fun.
Okay, another small group. I did speak with Sean Henley about some of these items, and I will carry forward his comments when we get there. Let me go ahead and share. Do we want to do introductions, or is everyone familiar with everyone on the call? We're good? Okay.
I'm good.
I think I have summit or okay, wait, we'll go general updates. Oh wait, I forgot my introduction. Hello everyone, my name is Dr. Chelsea. I'm the program manager for Gateway to the Rockies Opioid Council Region 10, also referred to as GROC. Today is our July Advisory Committee meeting where we review the upcoming Executive Committee meeting agenda, also the full council agenda, and carry forward recommendations, comments, and concerns from our community. So general updates. Jeffco Sheriff's Office executed their contract for July 1st. We had a meeting with them, and they are ready to start their procurement process for their biomonitoring wristband. So super excited that project is going to get started. The $2.2 million that was awarded to Jefferson Center for Mental Health for their Soteria Landing building, that award is being postponed after JCMH has an internal board meeting on July 16th. So I will have an update about that award and contract at the August 10th Executive Committee meeting, which would be the August 6th Advisory Committee meeting. We have 2 renewal applications, Denver Recovery Group and Advocates for Recovery. They had 1-year contracts that do expire this year. They had a technical assistance training for how to use the UNO application portal on July 1st. Both applicants were in attendance. That training was recorded and emailed out to them with the slide deck. They have until July 31st to submit their applications. At the July 27th full council meeting, we will do reviewer onboarding. So all of our reviewers will claim their unit profiles and learn how to score those applications. They will have from August 5th to August 17th to individually score their applications in the UNA system. And then we will have group discussion on their continued funding at the August 24th meeting. Any questions about this? Comments about this? Okay. Summit planning, we are at, I looked this morning, we are at 88 attendees, which is great. It did allow me to get the budget to just under $5,000. I think I'm at like 4,700. That includes tote bags for everyone with the GROC logo. That includes the badges with the lanyards. That includes, we already have our signage for that. That includes sodas and waters, our coffee, looking at Santiago's and Golden to cater breakfast burritos. And then the sandwich place is what we had decided. I keep wanting to call it Jersey Mike's or Jimmy John's, but that's not what it is. The sandwich place for the box lunches, that does include chips, a pickle, mustard mayonnaise package, and the sandwich. Any questions on summit planning? No? All right. I am hoping to I have a funding area breakout session worksheet already drafted. I'm going to do a service area worksheet. There will be a digital and a hard copy that people will have the option to fill out. I did find an individual who will do our recovery story. They are a Region 10 resident. They are also a beneficiary of GROC funding. So I'm working with them on how they tell their story, different ways to tell their story in a way that they would be comfortable doing so with a bunch of strangers. So super excited we are working on that. I do want to come up with some type of stewardship doctrine or other type of statement release, because I have been receiving an influx of emails, at least one a day, requesting funding outside of our general funding cycle. I am judicious with those requests and bringing them to the council. Most of them are, we need scholarship funding to supplement the Medicaid cuts. That if too many people are asking for that, we don't have a structure around that. I just defer them to our general funding cycle. But every now and then I do get one that I am not comfortable deferring. I need to bring that to the council, who ultimately decides what we do with that request. But in this statement, some things that I think we should answer for the public is how much of the settlement funding should support direct patient care versus building a lasting infrastructure? If scholarship demands grow every year, what happens when settlement payments decline? What investments today reduce the need for scholarships tomorrow? And do we need a revised application prompt or scoring rubric? When I was meeting with our chair about the executive committee agenda and kind of talking about this need, he thought maybe doing like a request for information from all of our community providers of how the Medicaid cuts are impacting them would help us design this statement. So I want to get this group's feedback, thoughts.
As I'm listening to you,
oh, sorry, go ahead.
Go ahead, Amber.
I was just say, where would that live? Like on the website as a statement, or just what you would respond for a universal response when those requests come in? I guess I'm just trying to think of its actual like utility.
Yeah, we would definitely put it on our website, probably at the top of the funding page, but then I would have something that I can respond to in email when I get those outside requests.
I'm just wondering if there's an organization that you would want to work through to be able to do individual, like direct patient care, um, that you could, that they could ask for a total amount of money, scholarship funding from you. And then when you get those emails, you can refer them to whatever organization is actually doing that individual patient care.
So if I understand correctly, you're asking if there's an organization that we can say, like, here's $10,000. And when people ask for scholarship funding, I direct them to them and they determine if the scholarship is appropriate or not.
Yeah.
We can do that. That would have to be set up. I know there is another region that they allocated like $10,000 to a specific treatment center, and then they designated a review committee. And so as the scholarships come in, those 3 individuals review the scholarships, they approve or deny, and then they just report back to the council. So that is an option.
I was just thinking that with all the stuff that you have to do currently, it just seems like a misuse of your time to be worrying about doing scholarships for
Thank you.
individual patients.
Thank you so much for that. That is actually a topic of the executive session on Monday, is the evolution of my role, and the potential of hiring an additional 0.5 FTE or 20-hour a week, basically an administrative assistant to support me. So thank you for that.
It doesn't seem like the best use of your time when, you know, the organization that might be providing that would probably be an easier fit.
Yeah, that is definitely something that we can set up. I think that there's still a lot of outstanding questions with that, of like, we know they need to be a Region 10 resident. Did you check Signal? Did you check Fines? Did you check Medicaid? What other private scholarships have been pursued before GROC? Then what does that dollar amount look like? Like, do we need $10,000 allocated to that? Do we need $20,000 allocated to that? Are there only certain treatment centers that have been vetted that can pursue that scholarship fund? Andrea, Amber, what are your thoughts on this? Because you're both directly in that space.
I guess I agree with those thoughts in terms of coaching people to look at all avenues for dollars. I just know how tight it's stretched, especially with Signal and the BHA. But yes, I wouldn't disagree with that recommendation.
Dr. Chelsea, have you heard other ROACs, how they're handling this? Because I do feel like I work with multiple and they all sort of handle some of these a little differently. So have you heard or learned their lessons?
No. I know that the ROAC that does do the scholarship right now, they just lost their program manager. So I think that is on pause of how they approach that. And I also don't think they have as many treatment centers in their region to make it a very complex, where we have a lot.
That's true. I could see the demand being greater then too. When you say scholarships, I guess help me define that a little better. What kind of requests are coming in? It is just like a one-time supplemental. We have this gap, or like, and it's like an individual who. Because the other day I had a weird one where it's like they needed funding for a treatment center. Well, this wasn't specific to Jefferson County or the GROC region, but treatment center who is asking for a down payment before they could start treatment, which it's a little odd. But is this these kind of requests coming in for like these kind of gap fills or individual situations that are unique, like the one I just described?
Yeah, it sounds more like they're just seeing an influx of uninsured folks who can't afford treatment. And so, how did they get their treatment paid for? And right now, a lot of those organizations are using like their own general funding to just consume that cost, which is exhausting them.
I think the other piece too is that a lot of agencies, if they are CSNP agencies in terms of our licensure and regulations, we are having to accept clients regardless of pay. We cannot turn them away. And so that puts a significant burden on agencies who have this regulation. And so we are looking for dollars wherever we can to offset the folks who are indigent and who don't have a way to pay for these services. Also, certain programming such as sober living, the funding was significantly cut, including from Signal. And so I know for Jefferson Center, we have dollars to pay for scholarships for rent, but we do not have dollars to offset, say, the salaries for our staff. So I'm guessing agencies are responding to some of those recent cuts that have happened specific to our population of folks who don't have a payer source. And then on top of course, the reduction in the PPS rate via Medicaid.
How many of these requests are coming from entities that we currently have provided funding to versus those that we have not?
I do know that we have one grantee that is seeking a budget amendment to double their services because of their wait list. I have asked them to pause on that request. I would say most of the requests are from entities we do not fund. I did create just kind of this, can you see this like request for information?
Mhm.
Okay. So I did kind of create this as a starting point. Legal, this is not a funding opportunity. But just to, again, just a request of information of like who is being impacted and in what ways. So they would give us their organization, the counties that they serve, the organization type, profit, nonprofit, community behavioral health, private. And again, it has to be specific to opioid related services. So they would check all that apply, report the annual number of individuals receiving opioid related services, what changed, was it Medicaid, federal, state, county, other, kind of giving us an effective date, an estimated funding impact, what operational changes have already occurred, reduced in specific services, which opioid specific services have been reduced, which populations are affected, individuals with opioid, individuals at risk of opioid use, a family, justice involved, pregnant, postpartum, general behavioral health, other, what percentage of the effective program directly serves individuals with opioid use disorder, describe the consequences if funding is not replaced, which opioid-related services are at risk of disruption in the next 12 months. Have you identified replacement funding? If it's not secured, what would happen? Which of the following best describes the funding needed? Expanding, maintaining, temporary bridge, replace lost, infrastructure, workforce, other. If opioid settlement funding were unavailable, how would you respond? Which of the following best describes the direction future GROC funding should address? And then 2 just kind of like open-ended questions. And this would be open probably like July 14th to like mid-August, just so that we can kind of see what the landscape is. Is that sounding good? Okay. I will go ahead. Thank you so much for this. So that does lead us into Hard Beauty is requesting funding. They approached me, they sent an email specifically like through a rapid response. I'm very hesitant to open rapid response because if I open rapid response for Hard Beauty, I need to open it for everybody. And I just do not have the capacity to take on 50 letters of intent. And so I do think this might qualify for sole source funding. They're primarily funded through Signal. They deliver recovery services to pregnant, postpartum, parenting women at Lutheran Hospital. Also, just for record, Peggy Jarrett is our Intermountain Lutheran rep, but she does not have a conflict of interest because she does not dictate the budget related to Lutheran Hospital Intermountain Health. So there's only 2 hospitals in Region 10, Common Spirit and Lutheran. Common Spirit does not have a labor and delivery department. And then Hard Beauty provides, again, like I said, recovery coaching services for pregnant parenting women experiencing substance use disorder at Lutheran Hospital. She lost Signal funding in June. The Stedman Group is funding their operations July of 2026. She initially asked for $27,000 to fund July 26 to, it would be August of 26 to July of 27 for 1 year. And I said, I probably can't do that. What is more likely to happen is that we could provide bridge funding through the end of 2026, which would be 5 months, while she works with Lutheran Hospital to pursue their community fund to take over the program, and also just help with a more stable phase out if necessary. It would probably be a little bit under $11,500 because her budget included a 15% indirect cost, but we only approved 10%. I'll pause to see what folks' questions are around this. Or comment. If you want to see a budget, if you want me to pull up the sole source funding mechanism in the SOP.
I don't have any questions or concerns. I think it sounds like a great program in the sense of, you know, what they're providing for those mothers in L&D. I think it's really important, and it's sad that the funding is only going through this month. I agree with you that we shouldn't do the full year, that, you know, it sounds like it's a short-term request that we should consider, and not funding outside of our normal funding window for something that long term. So I agree that it should be shorter term if we do it.
And I can give you a little bit of internal kind of how community benefit works. And so for our community benefit, it has to be aimed out towards the community and not internally towards our patients. And the other thing is that we have already done our whole budget, and we've already gotten everything spent for 2026. for the community benefit budget. So there currently isn't any money that would be available for them. However, from community benefit anyway, there might be some money that they could look for through our foundation. So that's the only other place they could look for money. But there's no community benefit money that they can apply for at this current time for 2026.
So just to make sure I understand, so if I'm someone out in the community and I need this service, I can access it. I do not have to be a patient at the clinic or wherever it's embedded. I can still access it. That's how the dollars are used as a community benefit. Is that my understanding?
Yes, if we're giving money to community benefit or to Hard Beauty, and all of the services are at Hard Beauty, and it's not necessarily tied to anybody who comes to Lutheran specifically. If it, you know, if it's anybody that's a Jefferson County resident and is accessing it, then that's totally perfectly fine. If Hard Beauty is only using those funds for patient care at Lutheran, that's where the problem comes with community benefit dollars.
Gotcha. Okay, thank you for that clarification.
Yep.
And I would have to go through the materials she sent me. Those were emailed out to you. I put together a little packet. I think it starts with if a pregnant or postpartum woman with substance use disorder shows up at Lutheran, Hard Beauty is called, they come in and then they take over the case management. So they help that person network with New Directions, Sober Living, which specializes in pregnant parenting women, get them connected just with other resources available to them in the county, treatment, care. So I think Lutheran is the starting point, but it's not closed doors. They are also in several other hospitals, but they're outside Region 10. And so I did clarify that this funding would only be for Lutheran Hospital.
And that's the point. That's what I was getting when I was looking at their submission to you, their application, that it was a lot of it was for the amount of money that the peer support people would be involved in, and a lot of it was at Lutheran. And like I said, community benefit looks outwardly, but the foundation money that they also have access to would be for internal hospital patients. So it's just that the rules are pretty specific in terms of community benefit dollars, and they have to be spent for, it can't just be for our patients. And a lot of times the departments in the hospitals just think that that money is for anything that is free to the public. So like a lot of times we'd have the pharmacy coming and asking us for Narcan funding for Narcan to give out to patients. And we're like, that's not money that we can do. If we were giving out the Narcan at a booth in the community, we can do that, but we can't do it just for our patients.
Are there any other questions on this? Similar to Erica's comment, Sean said this sounds reasonable to bridge through the end of the year while they do pursue other funding. He said it seemed like a pretty low dollar amount considering what most folks are experiencing right now with budget cuts. So would it be safe to say that the advisory committee does recommend this investment for the end of the year? Okay.
Yes.
Okay. Beautiful. Thank you. So Jeffco Public Health has a milestone discussion. I did meet with Jeffco Public Health right before this meeting, so I do have a finalized budget for them. As a reminder, this award was conditionally approved for $1,525,688.96 back in June of 2025. Due to contracting delays, they did not get started until June 1st of 2026. The first phase included a roughly $13,000 in early release funds, and then a needs assessment of the mountain communities for harm reduction needs. Then the needs assessment came back. There were some translation documents of what that looks like. At the June 22nd full council meeting, there was a vote that all 3 counties would participate in a harm reduction expansion program. Amber and I would review the budget for supplantation concerns. The council also requested that services be extended through December. The contract is set to end December 31st of 2027. The council extended that by 1 year, so December 31st, 2028, so that 2 full years of patient direct services would be included in this award. So that budget is looking at to be $1,538, $1,141,141.84. And so that numbers are so hard. So that would cover the whole award for about 2.5, almost 3 full years. Yeah, it would be 3 full years. We did decide to take out the leasing line item. And JCPH will pursue a budget amendment once they have a better idea of what their what their lease would look like. And so, for example, they are moving out of the Parfait building. Whatever building they move into, they're going to move into anyway. So GROC can't fund that lease because that is a general operational cost. However, if they were going to move into like a 5-office building, and then because of this GROC award, they need 7 offices, GROC could fund those 2 offices. It has to be the expansion. That's not a general operating cost. They don't know what building they're moving into yet, and so they don't know what that how they would figure out what incremental lease increase they would need. So we agreed to just take that off for the sake of Monday's meeting, and then they could pursue a budget amendment once they have a better idea of what formula they would need to use to cover the expansion of the lease. We had estimated $5,000 per mountain county in harm reduction supplies, and based off of the Clear Creek Public Health application last year. And so doing like 2.5 years, we calculated about $7,500 in harm reduction supplies to each county. So that was included in their budget. Of course, as they're on the ground and they're determining what that need is, it might be a little higher, it might be a little lower. And then also for their personnel, they put everyone at a 0.4 FTE as a safe estimate of what the work would look like. And we have agreed to touch base every month to see if those are tracking higher, lower, or on par. So we are keeping an eye on that salary. Generally, Amber and I are satisfied that there's no supplantation, that we have good communication plans for those, again, projected items as they implement a new program. Any questions, comments, concerns?
Nope.
Awesome. And then upcoming agenda for July. So the executive committee does not have delegation to approve a sole source funding. They basically just do the initial vetting. If the executive committee decides on Monday that hard beauty should advance through sole source to the full council, I will work with hard beauty to complete an application in EUNA, and we would use that as kind of our sample application in the EUNA onboarding at the July 27th meeting, for the full council to discuss that as a funding. Some minor changes to the conflict of interest statement. Carrie is reviewing that right now based on our conversations in June. We are in a conceptual agreement of what the conflict of interest statement is. It's just trying to figure out how to articulate that in writing well. So hopefully I have that final draft by the July 27th meeting. Our 6 people who were sponsored to attend the National Opioid Conference in June will do a brief presentation on what they learned. They'll show us some pictures, and that's it for July 27th. Quick meeting. And then the rest of from 2 to 2:30, the executive committee will be in an executive session with the legal team to discuss the evolution of my role. Because the job I'm doing is definitely not and nowhere near the job I was hired to do. So getting that in alignment with HR, that might come with a job reclassification, which would come with a salary increase. The council has to approve that. How do we fit that into the strategic plan? Are we at a point where we need to hire me an assistant to do some of these other things for the council? So they will be having that conversation in closed doors. But of course, if you guys have any comments on that, you can leave them with that group before we exit. And you can always email our chair, Commissioner Marlin, if you have any questions, comments, or concerns.
I don't have any questions or concerns about that. I just had a quick question about the JCMH. So with the Medicaid cuts that are happening and them having to get rid of their adult residential recovery, I'm assuming that is Soteria Landing, right?
I think that's a different project.
Okay.
Because right, Andrea, JCMH has all of these different treatment areas, and then Soteria was just going to combine them into one building.
So it was our 3.5 that was a part of the overall project recommendation. So it was our 3.5 adult residential, our withdrawal management, and our crisis services. Those are the 3 teams that we wanted to have in one location. And yeah, with the closing of adult residential recovery, that has certainly had an impact then on the overall plan for the use of Soteria Landing. So I know, I'm guessing that is the communication that will happen after the board meeting to come back with a recommendation for that change would be my guess. But yeah, as of August 7th, adult residential recovery will be closed.
Do you have any idea, Andrea, how that will affect the funding on the GROC side? Like, would they still be asking for funding in some way, or is that just done?
Honestly, I don't know enough on that side of things to speak to that. I don't know what the recommendation is coming forward. with that funding.
All right, I did put Commissioner Marlin's email in the chat. That is the current GROC chair. So again, if there's any questions, comments, concerns heading into the executive session, you can email him. Unfortunately, you will not be able to attend that session. Neither will I. Otherwise, thank you all for a great meeting, and I will see you all later.
Thank you.
Have a good day.
Bye.
Bye.